I'm Kyle Brown. I'm a professor of internal medicine in the Division of GI Hepatology, and I see patients with liver disease. Fatty liver disease is one of the most common causes of liver problems currently, and it's been a tough problem to try and get a handle on in terms of treatment. We know that there are many risk factors for fatty liver disease, of which being overweight and having what's called the metabolic syndrome, meaning diabetes, high lipids, etc., are major risk factors. So the question arises, how can we deal with those, or how can we address those risk factors? And so diet and exercise are an important component of the approach to this problem. It often comes up as to what kind of diet is the best diet for taking care of somebody who has this problem. And it turns out that there are various diets that will work in the sense of, at least in the short term, being associated with loss of weight and generally improvement in liver enzymes and potentially in decreasing the amount of fat in the diet. But there's a consensus that perhaps one of the best ways to address this from a dietary perspective is with the Mediterranean diet. The Mediterranean diet was recognized 50 or 60 years ago as being associated with a decreased risk of cardiovascular disease. And it turns out that it's also associated with decreased risk of having metabolic syndrome and fatty liver. And there have been some studies that show that if you haven't been following a Mediterranean diet, beginning to follow a Mediterranean diet can result in some degree of weight loss and improvement in metabolic parameters, including improvement in fatty liver. So the Mediterranean diet is basically a diet that focuses on fruits and veggies and whole grains as the mainstay of the diet, poultry and dairy products making up a somewhat smaller component, as well as seafood, and really much less red meat than would be typically present in a standard U.S. diet. So with the general recommendation for a Mediterranean diet is that you have red meat only once a week or less. This would also mean avoiding things that are high in fat for the most part, avoiding sugary snacks, and avoiding ultra-processed foods. So the reason to sort of favor this diet is not only the beneficial effects on fatty liver, but because of the fact that it's associated with other health benefits, and also because it's a sustainable diet. Lower calorie diets certainly can help with weight loss, but they end up often being difficult to stick to in the long run. So that can be challenging, because anything that you do to try and address this problem has to be something that you can stick to in the long run. Exercise is also important. Any kind of activity that keeps you moving, 2 hours a week or so is the target that is generally recommended to try and help with this condition.